Salale University College of Health Science, Department of Nursing, Obstetrics and Gynecology, post-basic student. Reproductive health session objective. At the end of the session, students will be able to define reproductive health, describe historical development of reproductive health, list the components of reproductive health, define and differentiate gender and sex, describe the relationship between gender and reproductive health, describe the life cycle approach of reproductive health, discuss the indicator of reproductive health. Reproductive health. What is health? What is reproductive health? Reproductive health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters related to the reproductive system, functions, and the processes. WHO definition. Components of reproductive health care include 1. Quality FP counseling or family planning counseling, information, education, and service, prenatal safe delivery and postnatal care, including breastfeeding, prevention and treatment of infertility, safe abortion services where not against the law, treatment of sexual transmitted infections and the other conditions of the reproductive system, management of complications of unsafe abortion, information and counseling on human sexuality, active discouragement of harmful practice such as female genital mutilation. 9. Referral for additional service related to family planning, pregnancy, delivery and abortion complication, infertility, STIs and HIV/AIDS, and cancers of the reproductive system, including breast cancer. 10. Advancing gender equality, gender equity, and the empowerment of women, eliminating violence against women and ensuring women's ability to control their own fertility. Gender and reproductive health. What is sex? What is gender? Sex is a biological and genetic differences between men and women. Gender describes the socially constructed roles, activities, and responsibilities assigned to women and men in a given culture, location, or time. Gender is learned and changes over time. Gender involves issues related to how women and men perceive themselves, think, and behave. Gender equality, equal treatment of women and men in laws and policies, and equal access to resources and services within families, communities, and society at large. Gender equity, fairness and justice in the distribution of benefits and responsibilities between men and women. Reproductive health indicators. To be representative, an indicator must adequately encompass all the issues or population groups in it is expected. 1. Total fertility rate. Total number of children a woman would have by the end of her reproductive age. Contraceptive prevalence. Percentage of women of reproductive age 15 up to 49 years who are using or those partners using a contraceptive method at a particular point in time. 3. Maternal mortality ratio. Number of maternal deaths per 1,000 live births from causes associated with pregnancy and childbirth. 4. Antenatal care coverage. The percentage of women attended ANC at least once during pregnancy by skilled health personnel. 5. Births attended by skilled health personnel. Percentage of births attended by skilled health personnel. 6. Availability of basic emergency obstetric and newborn care. Beam on C. Number of facilities with functions, basic emergency obstetric and newborn care per 500,000 population. 7. Availability of comprehensive emergency obstetric and newborn care. SEM ONC. Number of facilities with functioning comprehensive emergency obstetric and newborn care per 500,000 population. 8. Prenatal mortality rate. Number of prenatal deaths per 1,000 total births. Prenatal deaths occur during late pregnancy at 20 to 22 weeks gestation and over, during childbirth and up to 7 days of life. 9. Low birth weight prevalence. Percentage of live births of low birth weight less than 2,500 grams. 10. Prevalence of anemia in women. Percentage of women of reproductive age 15 up to 49 years old screened for hemoglobin levels who are anemic with level below 11 gram per dl for pregnant women and below 12 gram per dl for non-pregnant women. Maternal health. Why maternal health? What is the need of learning about maternal health? Barbaachisummaan fayyummaa haadholii barachuu maali? Why maternal health is given a great emphasis? Fayyummaa haadholii maaliif xiyyeeffannoo guddaan kenname? What is the importance of understanding about maternal health? Waa'ee fayyummaa haadholii addaan baasanii beekuun maaliif barbaachisaa? Mother responsible for caring a child. Daa'ima kunuunsuu tajaajiluutti from intrauterine to birth. Gadaamisa qabattee hanga dhaltutti guddisuutti. Responsible for generating household income. Galii mana keessaatii waa'ee mana keessaa isii qabdi. For household activities and community activity. Idir iqub hojiilee manneen keessaatii fi hawaasa keessatti illee gahee guddaa qabdi. Haati jechuudha. Major consequences because of this of a mother. In developing countries, biyyoota guddachaa jiran keessatti the risk of under 5 these doubles or triples. Children malnourished and to die than children who lost their father. Child will die within 2 years, 3 up to 10 times more likely than those whose parents are alive. Economic burden, lost economic productivity. Good quality maternal health care is the single most important intervention to prevent maternal and newborn mortality and morbidity. Safe motherhood. Safe motherhood is ensuring that all women receive the care they need to be safe and healthy through pregnancy and childbirth. Why? Safe motherhood. Magnitude of the problem. 300 million women suffer from short or long-term illnesses related to childbearing. Maternal mortality is the leading cause of adult female disease in many countries. Disparities. Most of these in the world are occurring in developing world. From 2089 from 1989 maternal deaths du'aatii haadholii bara 2013 worldwide akka addunyaa waliigaatti 99% parsantii 99.286 is in developing countries, biyyoota guddachaa jiran jechuudha. Emergency obstetric and newborn care. EMONC Emergency obstetric and the newborn care is categorized into basic emergency obstetric and the newborn care and the comprehensive emergency obstetric and the newborn care. CMONC في BMONC. Basic emergency obstetric and the newborn care BMON at the health center level should include at least 7 signal functions. Hojiilee kallattii qabeeyyii yookaan ittiin daddabaran torba qabdi yaa tokko parenteral antibiotics, 2 parenteral uterotonic drug, 3 parenteral sedatives for eclampsia anticonvulsants, 4 manual removal of placenta, 5 removal of retained products, 6 assisted vaginal delivery, 7 newborn resuscitation. Comprehensive emergency obstetric and newborn care has 9 signal functions at district hospital. First referral level should include all of the following 7 BMOC signal function plus obstetric surgery, cesarean section, 9 blood transfusion. World Health Organization WHO recommends that there should be at least 4 BMOC and 1 CMOC facilities for every 500,000 population. Maternal mortality, maternal health, maternal this while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and the site of pregnancy, or from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. WHO 2010. Maternal mortality in Ethiopia. Maternal deaths account for 30% of all women aged 15 to 49 years. The maternal mortality ratio was 676 maternal deaths per 100,000 live births for the 7 years period preceding the survey of Kumalamahordok. This ratio is not significantly different from those reported in the Kumalamavishan EDHS. Ethiopian DHS and the 2000 EDHS. As joint report, Ethiopia reduced maternal mortality rate from 1,400 in 1990 to 420 per 100,000 in Kumalama by 69. Global cause of maternal mortality, direct cause, percentage datum, Abduati Fiduichu, hemorrhage, APH and the PPH, Hayarat native 7%, sepsis, Sararat native 9%, unsafe abortion, Kuralama to 7%, hypertensive disorders of pregnancy, preeclampsia, Kuralama to 7%, obstructed labor, Jahatu 7%, indirect cause, alkalat in percentage, existing cardiovascular disease, Lukota Hesi Rahotan, Buse, HIV, malaria, HIV, and anemia. Delays. The 3 delays. A model of the constraints to effective maternity care, deciding to seek care, identifying and reaching medical facility, receiving appropriate care, birth preparedness, and complication readiness to reduce delays.